It is Thursday. That means Dr. Joe is here to answer your pet questions. So if you have a problem with your pet, you can give us a call. The number is 918-460-KJRH. And he's brought along Halo this morning, right?
Yeah. Halo's a little female dog. She's about 9-10 weeks old. She is
so
probably
cute.
Yeah, she is really cute. It's an interesting mix here. We have no idea, of course, but I think she's a little bit of shepherd, maybe some healer or something in her. It's got kind of some speckly up here. You know,
and
we'll
if you're looking for
know.
a calm dog, certainly this would be a great dog for you.
Yeah, exactly. She's extremely submissive, as you see here. She's just kind of laying here waiting to see what happens a little bit. Very nice little dog. You kind of get her out of her shell. You don't want to raise your voice around her or anything, and just really encourage her. Interestingly enough, she's not a big treat dog, and so that makes it a little more challenging sometimes to encourage these guys a little bit.
To train them.
Yeah. Because you have to find something that she likes or associates with. And honestly, she will come out of her shell. She's good around, like some other dogs have been running around. She gets excited and starts playing with them a little bit. But for the most part around people like this, she's kind of calm. So.
And where can we find Halo?
Oh, well, she's over at Heritage, the Heritage Veterinary Hospital, or animalaid.org on the net.
Okay, let's get to the phones. First up today, we have Jim in Tulsa. Good morning, Jim.
Hello.
Hi.
What's your question?
Yeah, Doc, we have a 10-year-old Cocker Spaniel who was running in the house 10 days ago and pulled up lame on his back left leg.
Yep.
And we took her to the vet, had it x-rayed, and it's making kind of a clicking noise, and there's some ligament damage. And I'm just looking for I've done some work on the internet, and it says the success rate on surgery is not always 100% by any means.
Did they call it an ACL or a patella?
Well, they called it a ligament rupture, C-R-U-C-I-A-T-E.
Yeah, cruciate. And that's like your ACL that football players get hit a lot in their knee. Yeah.
Right. And I've done a little reading on the internet, and that, it's a pretty expensive surgery, and for a 10-year-old dog, that sometimes you let them rest and stuff, and they sort of not completely recover, but...
No, I kind of agree with you. Sometimes, a lot of times, what I'll do when we diagnose that, and it's pretty easy to diagnose, you can a lot of times feel that knee kind of move in ways that it shouldn't, and there's only one ligament that holds that, and that's your ACL. Now, I'm going to use human terms there. I mean, technically, they call it a cruciate ligament, but really the deal is, yeah, you kind of let him go, but one thing you told me is 10 days, and after 10 days, if we're still having some lameness, especially after we run a lot and stuff, you've got to kind of stabilize that somehow, and usually they can do that with a ligament. That's really the thing to do, because kind of long term, if you break one, you're about 50% likely to break the other one, especially if you weren't doing a lot to break it in the first place. In other words, if someone says, yeah, my dog kind of ran down a hill, jumped, and twisted wrong, that may have been too much force. If you're playing football and you get hit, you don't say, well, your other cruciate's bad. No, it's not bad. You got hit by some 300-pound guy or whatever.
Right.
But in that case, you might want to consider doing that, especially over time they can get some arthritis and some other stuff. So.
Okay, let's squeeze in one more call here. Head down to Mounds and talk to Melissa. Good morning, Melissa.
Good morning.
Hi.
I have a full-blood Labrador Retriever puppy, and I know she's in the teething. We don't know how old she is. I mean, she's somewhere close, maybe between 7 and 10 weeks old. And we give her everything in the world to chew on, but she's chewing on my furniture and my cord.
What I will tell people, and that's kind of dangerous, doing cords, and you need to reprimand her for that, and then put her in her carrier, give her a timeout, okay? And then just keep giving her stuff, and you're going to do that for several months here. I mean, dogs naturally want to chew. That's something that they do. It's almost like breathing, okay? But you get on them and you kind of do that, and you keep giving them things that they kind of like, and just perseverance there, because really they're going, they don't have actually they're not old enough and smart enough to know the difference between a furniture leg and a tree outside necessarily, or something to chew on. So you just need to keep guiding them, directing them, and it's okay to give them a timeout. There's no problem with that. You chew on the wrong thing, time out, and a lot of times they'll go, oh gosh, I don't want to get separated.
It works.
Yeah, absolutely, especially with electrical cords. Those can kind of burn them kind of deep.
Pretty dangerous.
Yeah, absolutely.
All right, we are out of time, but Dr. Landers is here every Thursday to answer your pet questions. If you missed any of today's segment, you can go to KJRH.com and click on the Lifestyle tab to watch it again, learn about other pets who need homes, and find out more about Heritage Veterinary Hospital, which again is where you can find Halo.